Hello everyone, I am Dr. Sunil Kumar, Consultant Orthopedic Surgeon, Brahmananda, Narayana Multispeciality Hospital. Today on the eve of Juvenile Arthritic Month, we will be discussing this disease, what is it, what is its symptoms and how we can manage this. We have with us Dr. Rajesh Singh, HOD, Senior Consultant Orthopedic Surgeon, Brahmananda, Narayana Multispeciality Hospital. So to start with, first of all let us know what is juvenile rheumatoid arthritis.
Juvenile arthritis is a subtype of arthritis which affects the younger population, that is people less than 16 years. The commonest age group is around 8 to 13 years. Initially it was called juvenile rheumatoid arthritis, but nowadays the name has been changed to juvenile idiopathic arthritis. Though it is an autoimmune disease, but it is different from rheumatoid arthritis in adults. The symptoms, the prognosis, the management differs. So the new name has been coined as juvenile idiopathic arthritis.
So Dr. Rajesh, what are the symptoms to which patient present to?
Any boy or a girl less than 16 years, if they have multiple joint pain with fever lasting for more than 2 to 3 months, should consult the nearest orthopedic surgeon or a rheumatologist or maybe a physician. Now this arthritis, which we call it as rheumatoid juvenile idiopathic arthritis, may present in various forms. It may present predominantly with fever, rashes, enlargement of lymph nodes, enlargement of liver, spleen, and they may have minimal joint symptoms. This is one type of presentation. This is commonly known as the Still's disease. The other type, it may present as predominantly joint pain, multiple joint pain, that is involvement of more than 4 joints with minimal fever and other symptoms. Or on the other hand, it may also present as a few joint pain, less than 4 joints. We call it as polyarticular, right? So this may be the presentation. So in any boy or a girl with multiple joint pain, fever for more than 2 to 3 months, should consult the nearest orthopedic or a rheumatologist, because early treatment has a lot of meaning in the prognosis of the disease.
Next, we want to know how frequently you see this patient in OPD.
I won't say juvenile rheumatoid arthritis or juvenile idiopathic arthritis is very common in my OPD, but yes, we get cases. The cases with predominant joint involvement, we take care. But the cases with predominant systemic involvement is sent to the rheumatologist. And in that subset of patients where the joint has been terminally damaged, which require some type of reconstructive or replacement surgery, we take care because we have the facilities of joint replacement surgery in our hospital.
We just elaborated the types of juvenile idiopathic arthritis. Now we come to management. How can we manage this?
So the most important part in the management of juvenile idiopathic arthritis is early diagnosis. Most of the cases who have problems, they are the late diagnosed cases where the joint pain is treated as just another joint pain with analgesics, with long duration of analgesics, and they ultimately develop joint deformity, organ damage. So early diagnosis is very important, right? Once the problem is diagnosed early, the prognosis is very good in about 2/3 of patients. The principles of management is first, yes, symptom control. They should be made comfortable, and then prevention of joint and organ damage by appropriate disease modifying therapy. With proper treatment, 2/3 of patients, they have a good prognosis. They go into remission, long remissions. But in 1/3 of cases, the course may be very stormy. They may require long-term disease modifying therapy and may end up in organ or joint damage that may ultimately require surgery later in the life.
So just now we discussed about juvenile idiopathic arthritis, its presenting complaints, symptoms to which patient come to doctors, and how we can manage this. Thank you, Dr. Rajesh, for your valuable information. I think people will get benefited from it. Now last thing I want to ask, what will be your message for the normal people in society?
Through this medium, I would like to impress upon the fact that don't think that arthritis only occurs in old age. गठिया सिर्फ old age में ही होता है. There are various types of arthritis, and it can occur in child, it can occur in young adults, middle age, and elderly people. So there are various types of arthritis, and all the types, if not diagnosed in time and not treated properly, may lead to joint damage and loss of function. So whenever there is a joint pain, multiple joint pain in any age group, be it a kid or a young boy with back pain, or a 30-year-old lady with multiple joint pain, or a 60-year-old with knee pain, early diagnosis and proper management is the key. So seek the help of the nearest orthopedic surgeon, physician, or a rheumatologist whenever you have a joint pain which is lasting for more than maybe 6 weeks, 2 months, 3 months. Do not ignore it. Do not just gulp some painkillers over the counter and feel comfortable. Thank you.